Good afternoon and welcome to Dateline HCC. Tonight's exclusive, Autism in America. The prevalence of autistic diagnoses has increased in recent years. According to the Center for Disease Control, an average of 1 in 110 children are diagnosed in America each year. Immunizations have been controversial in relation to autism diagnoses. However, CDC asserts that there is no evidence to support the claim that vaccines cause autism. Accordingly, researchers still do not know what causes it, nor do they know how best to treat a condition that causes one child to lack verbal skills and another to shoot basketballs on the basketball court all day. What they do know diagnostically is that 3 criteria must be evaluated in order to make a definite diagnosis of autism: social interaction, communication, and repetitive and restrictive behaviors. Tonight we'll be interviewing a family who has a 16-year-old autistic child. We'll be talking to him, his parents, and all relevant caregivers.
You know, we could notice things right away, right after he was born. He wasn't cooing like normal babies do. He was having a hard time breastfeeding. We couldn't, breastfeed at all. So we tried bottle feeding, and that wasn't really going well either. So just those normal things that come naturally when newborn babies, it wasn't happening for us.
Shows that by the time children are 8 to 12 months, they're really quite social. They often play games like peekaboo and recognize their caregivers by sight when they see them. Children that are suspected of autism, though, lack these socialization skills. Lacking eye contact would prompt a physician to do further evaluation.
Yeah, we also noticed too that when it was time for him to start sitting up, he wasn't sitting up like he was supposed to, and when it was time for him to start walking, it was very delayed. And it was really noticeable when the family got together at Christmas time, and his cousin was there, who was just a little bit younger than him. And there was just such a huge difference. The cousin was waving bye-bye. You'd say, "What's your name?" And he would say his name. And TJ wasn't waving bye-bye, and TJ wasn't saying his name. And little Garrett, he would point to things and would look at you when you would talk to him, and we would get none of that with TJ. It was very upsetting. It was very devastating for us as a family.
Do children with autism gain skills and lose them? The answer to that question is about 50% do. Researchers still do not know why this happens, but if you have a child that's not socially responsive, does not respond to you when you speak their name, or does not look at you directly in the eye, as parents, you need to pay attention. The diagnosis process for autism is very tricky. There is no blood test or brain scan to determine autism.
Yeah, by the time he was 2, we really started noticing that he just was not developing like a normal 2-year-old would. And I had had some concerns before and had talked to the pediatrician, and normal kid, but not so normal. So we actually did get a different pediatrician, and he was tested, and the doctor did say that he did suspect autism. And I was upset, but then on the other hand, I was glad that there was a reason for his behavior and how he was acting, because my husband and I just figured it was our way of parenting, or what we were doing trying to raise him. He was our first baby, actually our only child, and we weren't sure if we were doing things right or not, and so we thought maybe we were the cause of this. So it was nice to know in a way that there was a reason for it, but then at the same time it's kind of devastating when you hear that news that your child is autistic.
Beyond behavioral and family therapy, pharmacological therapy is a choice parents may consider to treat the symptoms of autism. Medications commonly prescribed for autism include antidepressants, atypical antipsychotics, stimulants, and alpha-androgenic agonists. These medications are meant to target behavior issues such as self-injury, aggression, compulsions, which are repetitive behaviors, and hyperactivity. Given those facts, pharmacological intervention may be an ideal plan of action for TJ and his family. With the use of drugs as an intervention with autistic behavior, the parents must be in tune with their child and be able to recognize when the child may be exhibiting side effects of the medication. For instance, in TJ's case, where he cannot verbally express physical ailments such as headache or constipation, common side effects of the drugs, it falls to his parents to advocate for him and be mindful of any changes in his personality or routines based on the effect of the medication.
TJ's 16 now. It's been a long road. It's been hard, but we have found some wonderful resources with the Hammett School. at the baby fold. He does get to live at home. He stays home with us, and he goes to school there during the day. And he's just in love with one of his teachers. His teacher has been really good for him, and they get along so well together. But it is still hard with the whole communication because he doesn't say very many words. I mean, there's a lot of grunting, and we have to constantly watch him because he does a lot of head banging up against the wall. He does a lot of rocking. There are times we have to lift on his hands to help protect himself. And here, hon. Here, it's okay. Here, there's some right here. Don't worry about those on the floor. There, Mommy will pick them up later. So, you know, it has been hard, and we do the best that we can, and he's come a long way compared to how it was before. And there are times when he does get very upset. Sometimes he has a hard time sleeping at night, and music seems to soothe him. So a lot of times I'll put music on at night, and he likes that. And there are times too where sometimes the aggression or his moods can get out of control, and we will have to sedate him. The doctor has given us some medication for him, and those are really hard times. Those are very rough.
We interviewed Mrs. Church, TJ's teacher, because we know that TJ has a special bond with her. He often responds to her voice by making eye contact and guttural sounds. We asked Mrs. Church what intervention she's using at school to make TJ more successful.
I've been TJ's teacher for many years now, and although at times it may seem as though TJ is in his own little world, there are times that when I'm talking that you can just see this light bulb go off in his head, and you can feel him connect with me, and he looks directly at me and makes eye contact. Sometimes he'll nod his head in agreement with what I'm saying. And really it's times like those times of connection, when I'm reminded of why I do what I do. When you are trying to teach a child that has autism spectrum disorder, one of the most difficult things to overcome is the discrepancy between what is being taught in school and what's being taught at home. In truth, both parties really need to work hand in hand in order to ensure that the child receives the very best education possible. As far as what I use, as far as technique in teaching these children, I use something that's called ABA therapy. Basically, ABA stands for Applied Behavior Analysis. It was recommended by the American Academy of Pediatrics, National Institute of Mental Health, and the National Academy of Science. It is an intensive, family-focused program, and it uses methods studying observable behavior. You also look at the teaching functioning skills, and then you would evaluate the progress of the child. By applying ABA principles to reinforce appropriate behaviors, and then you discourage the inappropriate behavior. This method allows an autistic child to grow and become more independent. ABA works well with autism because it is a spectrum approach. Works for one autistic child may not necessarily work for the next. And it's very important to consider that when you're working with these children.